Hi, I'm Dr. Michael Steinberg, Medical Director of Cardiothoracic Surgery here at Memorial Hospital in South Bend.
Hi, I'm Shakir Aslam, one of the interventional cardiologists with Memorial Advanced Cardiovascular Institute. I think I should also mention that, as was alluded earlier, that the treatment of valvular heart disease has changed over the last many years. In the past, we always waited till the patient develops symptoms, but sometimes that may be a little bit too late. So, we're really trying to catch the patient at the early stage, which is most optimal for their treatment. And a lot of patients with valvular heart disease can be completely asymptomatic, and they don't get discovered until they go on to having some other kind of surgery or some other kind of treatment, and they do some testing and find out they have heart problem, which has been going on for many years and has not been taken care of, and that sometimes it may be too late to treat them. And we have seen that, in the past, that patients have been completely asymptomatic and they've been just cutting down their activity. They feel that's normal. As they're getting older, they're getting tired, they're getting short of breath. So instead of seeking more, evaluation, they try to get back to their activity, and they feel it's just normal, but it's not really their age or something else. It may be the heart disease or something else causing them to slow down. And when we do the testing, we find out that they have significant other problems. And we also have seen in the past, some of the patients who have congenital valve disease like bicuspid aortic stenosis, or bicuspid aortic valve, or moderate severe aortic stenosis, and they get followed up over a long period of time. And by the time they get to see a cardiologist or a surgeon, they already have developed significant left ventricular hypertrophy, and now they're left with dysfunctional heart, something that could have been treated early on and could have been prevented that way. Mike, do you have any thoughts about that?
I totally agree. I think one of the things that's changed here in the last 5 to 10 years is we've increasingly shifted to the left in the natural history curve, the point at which we intervene for valvular disease. And the old days, and by that I mean the 80s and the 90s, those results are skewed because we as surgeons and as cardiologists and as primary care doctors all waited too long to intervene. And it's clear that the sooner that you can intervene in a patient's natural history, their outcomes, both short-term and long-term, will be far improved. So for sure, we want to catch people before they have irreversible changes to their heart that leads to detrimental function. But we're also here for long-term care of patients that may just need to be managed medically. And so I think we really want to try and take care and assume the responsibility for the care of the whole spectrum of valvular disease patients. And so please use us, don't hesitate to call us, and we'll be happy to take care of and follow all of your valvular patients for as long as need be.
I should also, Mike, add to this, as we know, there are a lot of different treatment options now. So sometimes patients, look it up on the internet and they go to, out-of-town hospitals thinking that they're going to get some certain kind of treatment, and then they go up there and they get the same treatment that, is standard of care. And so something that they can get at home rather than going out of town. And, some of those patients, if we evaluate them and we feel that they will need, they'll benefit from minimally invasive surgery or percutaneous treatment or some of the newer treatment, we can guide them in the right direction. We're not going to ever, misguide them and not offer some of those newer treatments, even if we may not be able to offer those, locally at this hospital. And I think one of the other things that we should emphasize that when the patient is seen on an elective basis and all these surgeries are planned ahead of time, there are a lot of other treatment that we can do ahead of time so their perioperative course is better and they don't get some of the post-operative complications that will happen if they get these kind of surgeries on an emergent basis. Mm-hmm. And as Mike said, some of these patients, they may not need treatment, surgeries right away. They may need just medication. So somebody who has for example, severe mitral regurgitation and they're asymptomatic, we may be able to start them on some of the medication and prevent their worsening of the heart failure over a long period of time. So somebody who might need surgery in 5 years, with some of those medications, we might be able to delay that up to 10 years or even longer. Treat their risk factors, treat their, hypertension, high cholesterol, smoking, weight loss, and some of those other activities. And that certainly does prevent the progression of the valve disease. and they may never need treatment for those valves if we do some of those interventions as well. And also Memorial Heart Valve Clinic has those options available, and we can guide them to the right sources. We can give them education. We can, answer the question that they might have. So I think some of those options are also unique to the valve clinic and to this multidisciplinary approach rather than, when they go see, somebody outside the clinic.